You are now live.
Oh, it is that time. Good evening, Mono County, and welcome to the COVID community conversation for March 4th, 2021. My name is Brian Wheeler from Mono County Public Health, and I'll be your host again tonight. And again tonight, we will be joined by officials from the town of Mammoth Lakes, the county of Mono, and also Mammoth Hospital. But as usual, we will kick it off with Stu and his slide presentation. Stu.
Thank you, Brian. Welcome, everybody. I want to take a little bit of time to welcome everybody who's tuning in and everybody that has tuned in for the past, I think, 51 weeks, right, Brian?
Yes.
We've been at this for a long time, so we certainly appreciate and acknowledge everybody's diligence and curiosity, perhaps, and willingness and support of our community conversations. So thank you very much. Also would like to welcome many members of our global audience that kind of watch from near and afar. In particularly, my mum always watches from Australia, and my mum is also celebrating her birthday today. So happy birthday, Mum. We're going to jump into our community conversation for March 4th. I'm just going to pause on this slide to welcome our Spanish speakers, and Teresa is just going to walk through the instructions. This is a new updated slide, 3 simple steps. So you can kind of follow steps 1, 2, and 3. Teresa's going to walk everybody through if you want to listen to our wonderful Spanish translators. All right, hopefully that was enough time. Again, if you're looking for any Mountain View Fire resources, please jump on the Mountain View Fire Incident Portal. You can see the website address right there in the middle of your slide. And Justin and the team do an exceptional job updating the Mountain View Fire Resources and Recovery Facebook page. Each and every presentation, we start with this slide. We update a few of these images. We update a little bit of this copy. But again, we just want to reiterate now more than ever, please keep doing the basics. It's keep your distance 6 feet or more, continually wash, sanitize your hands, and keep wearing your face mask. We want to make sure everybody is getting vaccinated when it's your turn. So please pre-register. And again, stay informed, be civil, and respect each other. Because again, we want to stay safe to stay open, and not only stay open, but to reopen a lot of our businesses that have been closed through the regional stay-at-home order or through the purple tier. If we all keep doing the basics, we'll be able to move through these tiers. So thank you. Let's just jump into the metrics as we do each and every presentation. These are the county cases by region. You can see here we're up to 959, just creeping ever so closer to that 1,000 mark. You can see here we're not that close, fortunately, to California, which is over 3.5 million cases of COVID. And the United States is almost at 30 million cases of COVID-19. So in our little county, I think we're doing remarkably well. 739 cases in Mammoth Lakes, 110 North County, and 103 cases in South and East County. What does this mean? It means we're doing a great job flattening the curve. Our 30-day increase is now down to 5%, or just 47 cases over the last 30 days. So great job, everybody. Let's keep it up. Let's jump into the latest metrics that we get from our county health department. I thank Emily and the team doing a fantastic job keeping us updated, keeping us informed of what's happening in our county. So we've just kind of indicated the last 2 weeks of our metrics. So you can see here the positivity rate. The most recent week, which is 221 to 227, was 2.38%. And the week prior, you can see, was just under 2.7%. So everyone's doing a great job. And the other metric here we look at each presentation is our adjusted case rate per 100,000 people. And you can see again, we're declining from 5.1 now down to 4.1 per 100,000 people. So again, everybody's doing a great job. What does this mean? This slide gets a little bit more complicated each week, but let me just walk you through it. We keep the little graph on the right there to kind of track where we're at. But again, our state metrics. So we go by whatever the state has on their website. And as of February 20th, you can see our case rate was 5.1 and 2.6, which is the metrics we showed you on the previous slide. To move to the red tier, so we've got to kind of meet some criteria here. So we've got to be in our current tier for a minimum of 3 weeks, which we have. We also must be, and we must meet the less restrictive criteria for 2 consecutive weeks. So our metrics demonstrate that we've officially met the positivity rate and the case rate for that 1 week period, right? So we're halfway there. So to get to the red tier, we need to meet these red tier criteria for the week of 21 through February 27th. And then we would be formally or officially permitted to advance to the red tier, and that would be as soon as or earlier, no earlier than March 10th. So I'm going to pause there and have everybody catch up so you can kind of look at that slide. Again, the state publishes this information every Tuesday at noon. So we will know next Tuesday, March 9th at noon on the Blueprint for a Safer Economy website if we meet the criteria to move to the red tier. We can certainly spend a little bit of time tonight on the panel talking about this as well. So summary of red tier status. If we are fortunate enough to move to the red tier, this is what it means. A couple of changes here. Retail moves to 50%. Restaurants can finally open indoors. I think it's been 3 months. I think since we've been kind of indoor restaurant operations. So they are now able to operate if we are permitted to move. That'll be up to 25% capacity or 100 people, or whichever is fewer. A couple of other ones here: museums, places of worship, movie theaters, hotels and lodging. You can see there that is under actually the town lodging order. Gyms and fitness centers up to 10% capacity. However, family entertainment centers are still only permitted to operate outdoors. All this information and more can be found on the Blueprint for a Safer Economy. We have this slide each and every presentation. Encourage everybody to type in covid19.ca.gov/safer-economy. Related to our tier system, Mammoth Unified School District has provided this information to the public. Reopening dates: elementary from TK through grade 2 opened on March 1st. Grades 3 through 5 are scheduled to open on Monday, March 8th. And if we meet the red tier metrics, which we'll know on next Tuesday at noon, the middle school will open on March 15th, and the Mammoth High School will plan to reopen beginning March 22nd. However, if the county does not officially enter the red tier on March 10th, these opening dates could be delayed. Just want to remind everybody that the town lodging order was effective March 1st. This replaced the January 31st order, and this order will remain in effect until April 30th unless rescinded, modified, or extended. Again, just quickly remind everybody, all bedding, linens, towels, similar items must be laundered between each occupancy, or kitchen supplies, food prep areas, common areas, wash sanitizers, and occupancies are still limited to members of the same household or living unit. So again, the big takeaway is this is only applicable to the town. It's not applicable to the county. And the only requirement at this point is the mandatory 24-hour vacancy period. The 70% occupancy restriction was removed effective March 1st. Let's just jump into the COVID-19 vaccine dashboard. Brian and his team have received, you can see there, 10,528 doses. We've issued just under 4,700 first doses and just over 4,173 second doses. Again, all this information and more is on the Vaccinate Mono website. So jump in there to get this information. We update these metrics every Monday, Wednesday, and Friday. Just a quick update here from the state on how we're doing statewide, which affects how we do in our county. California is now administering, you can see there, 3 million vaccines. That's up from 1.4. Just under 10 million Californians have been vaccinated with at least one dose. We always understand that the, highly dependent on the supply of vaccine, but great news, Johnson & Johnson is going to be delivering the 380,000 doses of the single dose vaccine this week, which is great. And then we're also scheduled to receive in the wish we could receive 1.6 million doses in the county, but California is scheduled to receive around 1.6 million doses of the Pfizer and Moderna vaccine. Not too sure what we do with 1.6 million doses in Mono County, Brian, but I'm sure we'd put them to good use. Where are we now? Mono County is vaccinating residents aged 16 years and older with these certain underlying medical conditions that we've listed here on the slide. This list of medical conditions is from the CDC. So if you're looking for additional information, please jump on the CDC website. So again, if you are 16 years of age and older and you are experiencing these conditions, please pre-register, get you vaccinated. And we're also vaccinating residents 50 years or older. So again, the county, because we're doing so well, we've received permission from the state, from the health department to move into these tiers, to move into these ages and medical conditions right now. So if you are within this category, please jump in and pre-register. Do want to remind everybody that if you're scheduled for your vaccine, we will require proof of eligibility. You can see here that includes any of these examples: driver's license, business card, work ID, even a library card. Any document really that verifies you as a Mono County full-time resident. Must be a full-time resident of Mono County. We are not vaccinating second homeowners at this time. So again, please be prepared to bring proof of eligibility to your vaccine appointment. My Turn is the new platform for COVID-19 vaccine registration. We have been piloting My Turn, but the majority of our clinics are still being scheduled using our existing PrepMod system. When we do move to PrepMod, you'll receive an email asking you to pre-register on this platform. But for right now, please continue to pre-register for your vaccine by completing the online vaccine questionnaire, which is this one right here. Again, this can be found on the COVID-19 portal. Just click on the syringe icon or the vaccination icon there, top left-hand corner of the portal. And again, this is in English and Spanish, shouldn't take too much of your time. Again, it's confidential, only goes to public health, but this is the way to pre-register for you to receive an invitation for your vaccination appointment. So if you are older, if you are 16 years of older with certain underlying medical conditions, or 50 years of older, or if you're certainly a healthcare worker in that kind of phase 1A sector, please pre-register. We get this question a lot. I always keep including it. It comes up all the time. We want to make sure that, hey, I got vaccinated. Can I stop wearing a mask? No. There's still so many unknowns, unanswered questions. You can see here a lot of these bullets we include. Still trying to understand whether, you can still be infectious and whether you're still spreading that virus to others. Not too sure how long it lasts. As we know, they're not 100% effective, and you will still make people uncomfortable if you're not wearing a mask, certainly in those indoor settings. So please keep wearing your mask. Should you double mask? We talked about this last time as well. I won't dwell on it too much, but CDC has new guidance to improve mask performance. So again, whether you double mask or not, you really want to make sure your mask is fitting snugly. So it must offer good filtration If your mask doesn't fit snugly or in only one layer, please consider double masking. A lot of the masks these days with the cloth masks, have the 3 layers of fabric, which is great. If you're a healthcare professional, certainly recommending medical grade masks. And again, just remember those basics. Clean your hands, maintain social distancing, and just keep wearing that mask in public. Again, COVID-19 quarantine guidance essentially means if you've been vaccinated for more than 2 weeks, you don't need to quarantine, or within 3 months following receipt of the last dose, or have remained asymptomatic since the last exposure. You do not require to quarantine. However, even though you're not quarantined, still watch for symptoms for COVID-19 for at least 14 days following an exposure. Testing. Let's just pause here for a second. This is a big change at the Mammoth Lakes Foundation. So the County Health Department, Tyler and his team are doing an exceptional job. They are phasing out their testing. So they'll be testing for 1 more week, and that's every Monday and Thursday at the Mammoth Lakes Foundation, and that's from 11 a.m. to 2 p.m. So again, public health testing, if you've pre-registered, jump in there. You don't have to register again, just come along. It's a drive-through, self-administered. Those results are back expeditiously, I think less than 48 hours, which is great. But we are welcoming OptumServe to Mammoth Lakes, and they are now testing again at the Mammoth Lakes Foundation. This is an indoor testing operation, and they are testing every Tuesday, Wednesday, Friday, and Saturday, so 4 days a week, for 8 hours, so from 11 a.m. to 7 p.m. So again, 11 a.m. to 7 p.m., Tuesday, Wednesday, Friday, and Saturday. You can see here is at no cost for individuals, regardless of insurance status, open to all ages. Appointments are preferred, but not required, and they certainly are welcoming walk-ins. With that, I'm just going to pause for a second and just invite Dr. Burrows to speak about the importance of continuing your COVID-19 testing. Dr. Burrows.
Thanks, Stu. A question that comes up frequently is, well, if I'm not sick, if I'm not symptomatic, if I haven't been exposed to anybody, or if I've been vaccinated, should I bother being tested? And I'm going to say, somewhat selfishly, the answer is yes, because this is the one thing that you as a community member, or we as community members, can do to help our own cause. I guess first and foremost, this is a way for us to continue to monitor the prevalence, or how many people have COVID in our community. So even though we're doing all these measures and we're vaccinating people, and that's fantastic, and please keep doing that, we need to keep monitoring where COVID is in our community. I don't think anybody wants to find out the hard way that we have a new surge, and the way we're identifying it is the fact that more and more patients are presenting to the clinics or the sick clinic, the emergency room, or getting hospitalized. We'd like to find out ahead of time that, you know what, you're positive and you're not symptomatic, and that's wonderful, and we want to isolate you and prevent you from other people getting sick as well. Now, the selfish part of that is the more negative tests we have, the better our reporting numbers are, and that translates into us keeping our positivity rate down and our per capita, or the number of cases per 100,000 residents, down, which allows us to continue to advance through all of the different tiers. So as we talked about in the beginning of this presentation, we are right on the verge of moving from purple to red, which opens some things up, and allowing us to go from red to orange is only going to allow more things to open and allow us to get back more to normal. So please, if you're asymptomatic and you can take the time somewhere in those days that are offered to get yourself tested once a week, that would be tremendously helpful, and you're only furthering our cause as a community to move through these tiers and get our county fully open.
And Stu, if I can add something real quick on testing, you mentioned that public health would be phasing out. We're phasing out in Mammoth. We will become the testing group for the rest of the unincorporated areas of the county. So we will get a traveling schedule out there for the public. So people will be able to get tested in all areas of the county.
I was hoping you were going to jump in there, Brian, so thank you. And yeah, so our next community conversation, we'll have that schedule up. But again, please visit that little testing icon there. You can see it's the bottom right-hand corner of your slide. That is on the homepage of the COVID-19 portal, where all this information is available for everybody. So if you're looking for testing outside of Mammoth Lakes, it's coming, it's going to happen. Tyler and the team are going to be on the road. So look for that information. And again, follow Mono County Public Health Facebook page, where this information is posted frequently. Next bilingual community conversation, Thursday, March 18th, 5:30 p.m. And again, just to remind everybody, we always have this slide here. We have all this information and more, English, Spanish websites, email COVID-19 help@mono.ca.gov, and our COVID-19 newsletter issued every Tuesday and Friday right to your email box. So with that, I will turn it back to you, Brian.
All right, thank you, Stu. And again, I want to thank all of our panelists and all of our attendees to our meeting here tonight. I also want to remind the panelists that we do have translators, so occasionally pause during your sentences. That being said, why don't we move to our first question?
Following up on Dr. Burrow's comment earlier, should you continue baseline testing if you've already been vaccinated?
Go ahead, Dr.
I think you
Burrows.
should. Yes, I think you should. Just because you've been vaccinated, we know of a couple of cases, both locally and certainly reports nationally, that even people that have been fully vaccinated, it's still possible that they can contract the virus. They can potentially transmit it to other people. It's much less likely, and that's the reason we want to encourage people to get vaccinated, but it is nevertheless possible. And again, the importance of continuing to demonstrate the low positivity rate in our county is crucially important. So even for the sake of saying I got vaccinated and I'm negative, that's very important information, very useful and helpful to know vaccines working. We're not seeing an increase in cases here in this county.
Thank you very much, Dr. Burrows. And we go ahead and take our next question.
Will the serial hospital testing start counting towards our numbers?
Back to you, Dr. Burrows.
Yes, it will. We were doing antigen testing, and I don't want to dive back into the differences in all the testing, but antigen testing is a much more simple form of a means of diagnosing people. It was not something that was reliable enough that the state was counting it, because there's just too much variability between the way different parts of the state were doing it. But our new test in the hospital is effectively a PCR test, and that does count towards our numbers. So as I think everyone that is on this call probably knows, Mammoth Hospital has a huge number of people that live locally that work in our hospital system. So that's a big chunk of our population, and that can go a long way in keeping our numbers under control.
Thank you, Dr. Burrows. Go ahead, Dr. Boo.
Yeah, hi everyone. I just wanted to add a additional comment or two about testing after vaccination. It is very important. It's important to continue testing overall. I mean, our testing numbers are down locally and statewide, and I believe nationally. But one reason that we haven't really touched on tonight is to understand better what's going on with the variant strains, and particularly whether they might be more able to infect people after vaccination. And so the state is very interested in further evaluating vaccine failures. So if somebody, and you know, I would, Dr. Burrows, you know, spoke of people locally who've tested positive after vaccination. None of those are really known to be true vaccine failures. I mean, I don't think we've seen anybody who has been positive yet 14 days after completion of vaccination, which is the definition they're using. There's been a couple of people who've been tested for pre-op, you know, reasons and things like that at 7 days who were positive, and we don't know whether they acquired they didn't have symptoms, had never had symptoms, and we didn't know whether they had, acquired the infection a month before or sometime between the first and second dose, or after the second dose. But if there are true vaccine failures, which are to be expected, right? And I hope I'm not getting ahead of translators. But with 95%, effectiveness of these vaccines, but vaccinating millions of people, there will be people who get COVID after vaccination. But if we determine that somebody is positive more than 14 days and less than 3 months after vaccination, we will report that to the state, and we will seek what's called whole genome sequencing, and probably also a blood test looking at the type of antibodies that people have, to try to understand whether this is just the original, what they call wild type strain of SARS-2 or COVID virus, or whether it might be one of the variants. So the screening that the hospital is doing, and testing for other people who've been vaccinated, is very important. And I'm going on too long here, but I think it's also worth saying that there is emerging evidence that the vaccines do substantially decrease the risk of asymptomatic transmission. I mean, Stu spoke earlier about that being a big unknown, and it still is an unknown, but there is evidence emerging, like the Johnson & Johnson vaccine that just got approved. In their big trial, the phase 3 trial that led to approval, they did a smaller study within that, looking at antibodies in people who've been vaccinated, and they concluded that it decreases the risk, that the vaccination decreases the risk of asymptomatic infection by about 75%, which it's not 100%, but it's important. And I think there's some evidence for either Moderna or Pfizer, along those lines, that it may not eliminate asymptomatic infection, but it decreases it substantially. It probably also decreases the amount of virus that if I'm vaccinated and I get infected, it probably decreases the amount of virus that I'm carrying, and therefore the chance that I can infect other people. So there's good news emerging, positive news, related to these questions.
All right, thank you, Dr. Boo. And why don't we just move on to our next question?
If you've received first and second dose vaccine, is it safe to socialize with others who have received the same?
Dr. Boo, do you want to address that?
Sure, I'll take that. Yeah, I mean, I think it is safe. The risk is perhaps not going to be zero of asymptomatic transmission, that maybe somebody in that group could transmit to someone else who's not vaccinated. But the risk of somebody in that vaccinated group getting sick and ending up in the hospital is negligible, very, very low. And so I think it is reasonable. I'm not sure that's totally consistent with current CDC, CDPH guidance, but I think it's safe. I've had some email communication with residents about that, asking that question, and I think that's reasonable. I would still suggest people exercise good distancing, and outdoors still better than indoors, but it's pretty safe. Yeah.
And Dr. Boo, are we expecting any updated guidance from the CDC on that?
Sure. I think a ton of guidance that's out there needs to be updated, reevaluated as more people get vaccinated and we learn more about the effectiveness of the vaccine. So I think there's probably a tremendous amount of work going on at CDC and CDPH about such things. I haven't heard that there's anything about to be released or anything related to those kinds of gathering, but I'm not really in the loop on what CDC is focusing on.
All right, thank you, Doctor. Let's just take our next question, please.
With the cases that have popped up in the last few days, does that threaten our chance of moving into the red tier next week?
I think we've only had a few cases. I don't think it would interfere. And Tom, correct me if I'm wrong. I think we're still number-wise doing okay.
Right. No, it's interesting. What happens this week would really not officially affect our ability to move into the red tier. They're looking,
True.
you know, with a week's lag. So the state next week, what they'll be reporting to us is, you know, is the number of official cases counted towards Mono County as of last Saturday.
And Dr. Boo, if we move into the red tier, it would take 2 weeks at the purple threshold to be demoted again, correct?
No, I think it only takes one, but remember, to move into the purple, we've got a lot more latitude, right? I think we'd be held to that 35 case standard, right? I don't think they've changed that. It's harder to get from purple to red, but it's easier to stay in red and not go into purple. They give the small counties substantial leeway that way.
Yeah, this is Dan. The only other element there would be the percent positive rate. If it goes 8% or
Sure.
higher, over 8% would push us back. There is a time lag currently in that. It's a week they look at it, and there's you can argue to look at your last 10 days of data, and if you show positive movement still and stuff, it's not an automatic, at least in the current regs, it's not an automatic step backwards, but they can look at that at any given time.
I can tell you've read that more recently than I have, Dan.
Yeah, this morning.
Yep, things do keep changing.
Yes, they do. So anyway, yeah, so it is harder to go backwards, but the reason earlier talking about testing, just drive that home to folks, getting those testing and doing that. I think, you know, we should see a larger negative testing coming out just because of the vaccinations and the personal responsibility people are taking. And then if we do get a little bump up in cases that, you know, that could happen just from a family gathering, one group of folks could impact us. But keeping that positivity rate down below 8% is a real key factor for us. And so, plus just making sure you're staying healthy yourself and not asymptomatic, et cetera, you know, getting the testing, I think should be a really high priority along with getting people registered for vaccination.
All right, thank you, Dan, and thank you, Dr. Boo. Do we have anyone that's phoning in today?
We have one phone-in question from Catherine Allen. Go ahead and unmute yourself, Catherine.
Hi, Catherine. You're still on mute.
Isn't Catherine one of our translators?
I believe you're right, Dr. Boo. Perhaps she does not have a question. Okay, why don't we just take our next question?
If someone already pre-registered for vaccination but has one of the now numerous underlying medical conditions such as hypertension, should they register again, listing an underlying condition?
So yes, if you've registered and didn't list an underlying condition, I encourage you to go back in and re-register with that condition so that we can get you an invite. All right, next question.
What protocols are being developed and put into place now that were not there before? And how much do you think the county, state, and nation have learned from this ongoing pandemic?
Ooh, that's a tough question. I'm going to throw that to the doctors first.
Can you repeat that again?
Sure. What protocols are being developed and put into place now that were not there before? And how much do you think the county, state, and nation have learned from this ongoing pandemic?
Well, I can tell you that one of the things we've learned for sure is when you're sick, you should not expose yourself to other people. I don't know if we've learned that or relearned that the hard way, but this notion that you tough it out when you're sick, you go to work, you go to school, whatever it is that you have to do is, I guess I could say based on lessons learned here, ridiculous. don't go to work, don't go to school, stay isolated, make sure you're not symptomatic anymore. And then when you are no longer symptomatic is when you should go back to what you normally do. This notion of being tougher than whatever it is that you're dealing with is probably self-defeating and only contributes to more people getting sick. I don't know specifically if there's anything else that we've learned about COVID that makes me feel like we've changed things, other than a lot of the protocols that are in place we've certainly refined, where we're much more aware of different signs and symptoms. We do a better job screening. We do a better job identifying people and doing contact tracing. I think just with time, we've really refined our ability to identify people, get them out of the population as quickly as possible as far as spreading this and riding this out.
And Dr. Burrows, given the amount of positive influenza cases we've had this year, how do you think that relates as far as masking?
I think there's got to be a direct correlation. And we saw it in the southern hemisphere. We're seeing it in the northern hemisphere. I think it's an easy conclusion to make that washing your hands, wearing a mask, and distancing prevents spread of anything, COVID, influenza, or whatever that's contagious. And by following all those practices, you're clearly going to see less spread of these type of infections. And I think probably most people on this call, and probably most people anecdotally, would say, man, I haven't been this healthy for this long in a long time.
Yeah. And just for public knowledge, we've had 2 confirmed cases of influenza in the county this entire flu season. So those are just amazingly low numbers. All right, why don't we go ahead and take the next question?
Will the testing in Mono County do genetic sequencing?
I'll pass that on to Dr. Boo.
Yes, so there will be sampling, right? I mean, I sort of signed us up many months ago for whole genome sequencing. So the state labs that we send our specimens to, I'm not sure exactly what their protocol is, but they obviously have been doing a significant amount of sampling and whole genome sequencing from Mono County specimens. That's how we learned back in January that 25% of our cases in December, were the West Coast variant. But again, there will be also targeted whole. So they will continue to, the whole genome sequencing is time and resource intensive. And it's not feasible to do gene sequencing on all the positive tests, throughout California. So they take, a subset. When I say sampling, that means they take a sample from different counties that have, asked them to go ahead and do that, counties that have agreed to participate. But there will also be targeted gene sequencing in cases like vaccine failures, which I tried to explain before, but probably wasn't very clear. So.
All right, thank you, Dr. Boo. Let's go ahead and take our next question.
With the ever-changing rules for who can get the vaccine, is it possible for those who are contracted to work at the hospital to be in a different tier?
Contracted, Dr. Burrows, if I could ask you who those individuals would be, that could probably help me answer the question.
Yeah, I don't understand the question at all.
Sorry, I'm on call for the hospital and I was muted while that was going on. Can you repeat that for me?
Sure. With the ever-changing rules for who can get the vaccine, is it possible for those who are contracted to work at the hospital to be in a different tier?
Contracted to work at the hospital. I would assume if you're working at the hospital, you count as an essential healthcare worker. So you would be, correct me if I'm wrong, but I think you'd be in 1A, right?
Yeah, I mean, if you're a hospital worker, you should be in that first tier. I'm just not sure
Right.
of what they mean by contract workers.
Right,
Yeah, I don't
right.
know. Sure.
Yeah, and again, I mean, even though you know, there's this move away from, you know, a tier-based approach. I mean, if someone is in a, you know, something like phase, you know, 1A, and was eligible a month ago, they're still eligible. I mean, that
Yeah.
hasn't changed. So yeah.
So the other thing I would just caution is there are people, and we've had this happen, that claim that they're working at the hospital that in fact are not. So if you are truly contracted to be doing something at the hospital, you need to provide proof of that. And believe me, they're going to call us and ask. And if we don't have any evidence that you are in fact doing anything at the hospital, that is not going to allow you to get vaccinated. I'm sad to say that's happened more than once now, where people have claimed, "Oh, I'm going to be working at Mammoth Hospital for the next 2 weeks," and the answer is no, you're not. You're just trying to get a vaccine.
Yeah.
But on the other hand, if you are, we will vaccinate you.
Absolutely, yes.
And the only difference is initially the hospital had Pfizer vaccine and vaccinated all their own staff who were interested in it, and now they don't, and so people would be vaccinated at a public health clinic.
Yes, that's also true. We do not vaccinate you specifically at the hospital.
What about laundry and construction contracted services?
So as far as the laundry facility who services the hospital, I believe we have vaccinated the majority of their staff. And what was the other?
Construction.
Mm-hmm.
Tom, any thoughts on construction?
Yeah, construction's not really on the radar screen right now, but you know, we're making good progress, and vaccine supplies are expected to increase. So you know, we're optimistic we're going to be able to really open it up to everybody fairly soon in the coming weeks and, you know, month or so.
I agree, Tom. I agree. All right, let's take the next question.
I've been taking BioIQ at-home tests, where you FedEx the test kit to a lab out of state because these test kits are made available by my employer. Do negative test results from at-home tests help our county numbers?
Go ahead, Dr. Boo.
Yeah, so if the lab that's doing the test is complying with, you know, basically state law and reporting it through the CalReady database to the state and visible to us as well, then yes, it would. But I really can't speak specifically to whether that lab out of state is doing that or not.
But we have seen some results, I believe, from LabCorp that were mail-in tests. So, you know, you're right, Tom. It may depend upon the lab and their reporting mechanisms. All right, let's go ahead and take our next question.
Since personal care service employees have more hands-on contact with visitors, wouldn't they be a good candidate for testing? Also, last time our testing numbers were low, it was suggested hospital staff would be tested more. Is that something we could do?
Well, I'll let Dr. Burrows talk about the hospital testing.
So the hospital is testing employees. We have a program in place where every employee in the hospital tests weekly at this point. And and as I've said already a couple times, but I'll certainly say it again because it's very important for everyone to understand that those numbers now do count towards our county reporting numbers. And as far as someone that is working really in any capacity in the community or the county, testing once a week is, again, critically important, just to identify that we are still demonstrating low numbers of positive cases. And again, helping to keep our numbers down so we can keep advancing through certainly so we can stay in the red tier when we get there, and then hopefully advance to the orange tier.
And then the other portion of that is, you know, with increased testing, we can catch some asymptomatic people who test positive who could potentially start a cluster, and then we could get larger and larger numbers. you know, if we catch that person early and do the contact tracing and quarantine and isolate, it seriously impacts that, and again helps keep us in the red tier or whatever current tier we're striving to be in.
I said this way at the beginning of this meeting, but we don't want to learn the hard way that we were in the middle of a surge. Finding out who is potentially infected and potentially a spreader before they spread anything is going to allow us to prevent that from occurring.
Yeah, and yeah, thanks, Shaw. And again, the regular testing of vaccinated people, like in the hospital, is also it's a critical source of information, you know, for the state, the country, and hospitals around California are doing this. I mean, the state has asked hospitals to continue to test their staff after they're vaccinated. This is how we will learn about how often we see asymptomatic infections, and whether, you know, 3 months, 6 months, 9 months after vaccination, if we start to see more breakthrough infections and whatnot, we'll learn about how long the protection lasts, et cetera. So.
Good point, Dr. Boo, and thank you again. Good point, Dr. Burrows. Let's go ahead and take our next question.
Project Baseline does not list Mono or Mammoth as of 5 minutes ago. Has Mono been dropped from that testing program?
So
Project Baseline no longer exists, I think, you know.
Yeah, their contract with the state ended and is now being filled by OptumServe, a group called OptumServe. Stu, can you put up, do we have a link or a slide on that so we can get that information to that attendee?
Yeah, so it's a big change for us. You know, Project Baseline barely, you know, got off to a rocky start, but then they got a lot better over time. You know, made it easier for people to register, and they found ways to accept people who couldn't, you know, register online, et cetera. Turnaround times got better. That wasn't Project Baseline themselves, but just the labs got better. And so now we're sort of starting over square one with OptumServe, which has a lot of experience around the state, but you know, they're new to us, and the staff that are working in Mono County are also new to this role. So there could be sort of a break-in period with OptumServe as well, but we're optimistic. The labs are working well. There's a new courier system in place, you know, that the state is funding through OptumServe that will decrease the time it takes to get specimens to the lab, which will, we hope, significantly, you know, decrease the time for people to get results. So it's a significant transition, and we all just kind of have to take it as it comes, and bear with us a little bit for the next couple of weeks, I think. So.
Thank you, Dr. Boo, and thank you, Stu, for putting that slide up there. Greatly appreciated. Let's go ahead and take our next question.
Can we put out a reminder to everyone that just because we go into red tier, it's not a reason to let our guard down? If we're relegated to purple after we've gone to red, it requires another 3 weeks to get back to red again. No St. Patty's Day parties.
Yeah, I totally agree. Don't let your guard down. Go ahead, Dr. Burrows.
I was going to say the same thing. We are really right on the cusp of getting to a point where we can get more and more normal. And the last thing anybody wants to do is slip backwards. So yeah, please, we continue to encourage it. Don't let your guard down. Continue to follow all of the basic things that seem so simple but are so critical: wearing a mask, distancing, washing your hands. Yes, it's true that you can probably do a little more gathering with people that have been vaccinated, as Dr. Boo mentioned, but the idea that you can go back to these giant gatherings, and as we talked about, relevant to what's coming up, a St. Patrick's Day party, that is a surefire way to see if we can slip back into purple. And there's plenty of evidence that even with the best of intentions and screening people and demonstrating that they're negative over and over again before they all come together, those people are going to start testing positive, because that's the way this works. It's that contagious still.
Thank you, Dr. Burrows. Do we have any more questions?
Not at this time, Brian.
Question for the panel. Would anyone like to speak to the potential changing to the red tier and how that would affect the town and county?
What do you mean, Brian? I think Stu had a slide and just kind of reviewed some of the changes, like as far as businesses. But what do you mean?
Just kind of to review that, Stu mentioned that we should probably talk about that, and it makes sense
Okay.
to kind of reemphasize what that would mean for the town as well as the county.
Okay, so maybe yes, I think Stu's
There we
putting the
go.
slide back up. Yeah, there we go. Yeah. So the basic concept, of course, is purple tier is extremely restrictive of indoor activities, and red tier is a little bit more permissive, but at a cautious, limited level. So 25% of for indoor dining, 25% of capacity. Same for indoor religious services. Gyms and fitness centers are allowed to have very limited indoor activity. I believe it's 10%. It's print's a little small on my phone for seeing that, but yeah, but that's the concept. It's a return to some indoor activity. Stu could speak in more detail.
Still no indoor pools, Dr. Boo. I miss my swimming.
Yeah, and then all that information is again, on this website. So to Brian's point, and if you want to get into the detail that Dr. Boo was mentioning, jump into that website, refamiliarize yourself with, the tiers. I know it's been a little bit of a while, a few months, in fact, since we've been kind of in a red tier. So again, blueprint for a safer economy. And then if the county does achieve those metrics as established by the state, we will publish a press release that Tuesday afternoon. So we'll make sure everybody is well informed as expeditiously and as quickly as possible with that movement. So again, we still have to meet the metrics, even though we have indication that we will, unless the state validates our numbers. We'll be staying where we are. But indications right now, will put us in that red tier on Wednesday, March 10th.
All right, thank you, Stu. Do we have any more questions? Oh, go ahead, Dr. Boo.
I was just going to say, I mean, so nationally, I think many people may be aware that we've had this great, tremendously encouraging decrease nationwide, locally, statewide in the last month or more. But the decline seems to have plateaued nationally. I think some states, Texas, are starting to see an increase already. So yeah, the point about this isn't over, and we have to continue to stay safe is a very important one to take home. So.
Absolutely, and I believe we have one caller. So why don't we go to that caller?
Yes, Samsung, go ahead and unmute yourself.
Oh, hi, it's Cleland. I just wanted to thank all of you guys for giving out this information. I was such a diehard in like the first 6 months of this, and now it seems a little bit off my map. So thank you for putting out the message, because I started thinking, well, things are looking pretty good in town. Maybe I don't have to worry as much. So I appreciate the message that you're putting out. One thing is, as far as getting tested for COVID, I don't feel as I'm a candidate because I'm not in the age range and I am really not around people. I do have one person at risk who has been vaccinated. I would probably be getting the vaccine in the probably next 2 months. Is that something that I need to worry about if I'm a caretaker for someone who is vaccinated, but I'm around very few people? Do I need to hurry out and try to get a vaccine, or are we pretty much towing the line?
Dr. Boo?
Yeah, Cleveland, I think you're eligible for vaccination. more or less now. And I mean, I don't know how old you are, but I think you're about my age or something like that. Yeah, I would encourage you to get vaccinated sooner than later.
All right, and thank
I
you
would,
for calling
I
in,
would encourage her
Cleveland.
to get tested as well. Every
Yeah.
negative test helps us.
Absolutely.
And again, if you are a caretaker, knowing that you're positive or negative is still critically important to the people that you're surrounding yourself with, especially if they're risk, whether they're vaccinated or not. I mean, we assume that the risk is a lot less because that individual that you're around is negative, but there is still the possibility of transmission. And really, in any case, the idea that you could still spread this to somebody, no matter what their level of health or immunity is still a real thing. We don't know enough. I mean, 95% effective is not 100%, and you don't want to be in the 5% that, wow, I guess I was wrong. Turns out I should have gotten tested or vaccinated or both. That's a hard way to learn that was not the way to go.
All right, thank you, Dr. Burrows. And it looks like that's it for our questions in the queue tonight. Does anyone on the panel care to address our attendees, or do we just want to call it an evening? All right, well, in that case, until we meet again, take care of yourselves and each other. Good night, Mono County.
Good night.
Everyone.